Diabetes alert. The fault is not just your belly fat. Discover the shocking truth. Let's get straight to the point. Where the heck did your diabetes come from? This question hammers in your head, right? Especially for someone who just got diagnosed, the nagging thought is often, but how? Where did this thing come from? Why me? The answer you get isn't always the full story, but we're going to try to shed some light on this today and maybe surprise you. Let's go. Get ready and smash that like button to give us a boost. Hey, metabolic greetings everyone. I'm Dr. Anonymous, an endocrinologist, and my mission here online is to help you understand diabetes simply with no runaround. I want you to be more involved in your treatment, seek better results, protect your long-term health, and maybe even use fewer medications than you do today. Believe me, this is totally possible. I've seen it happen thousands of times with people I follow. What scares us most about diabetes, and rightly so because it's a serious disease, is the lack of results, isn't it? You know you need to improve. You try dieting, take medicine, but it feels like you're stuck. My goal here is to give you the knowledge to get out of that shadow, that feeling of powerlessness. So if you want quality information to turn the tables on diabetes, subscribe to the channel already. And if you like what you're about to hear, share it with everyone. Send it to that family group chat, to your friends, to anyone you know who needs this insight. Good information needs to circulate. All right, let's talk about your diabetes. Where did it come from? Well, I can't give an individual diagnosis here because I don't know you, but I can talk about what science understands today about the majority of type 2 diabetes cases. You've probably heard, maybe even your doctor said it, or you learned it in school, that type 2 diabetes is almost a direct complication of obesity. The usual story goes like this. First, a person starts gaining weight, then accumulates belly fat, although some start with the belly even before gaining much weight overall. And then, as an almost inevitable consequence of this process, diabetes appears. Is it true that this sequence, weight gain, belly fat, diabetes, happens to many people? Yes, it does. But here's the catch. It doesn't happen to everyone. There's a significant number of people who seem to skip the line. People who develop diabetes despite being thin, or people who are quite overweight but have perfect blood tests with no sign of diabetes. What I want you to understand is, this idea that fat is the only culprit, or the main factor messing everything up, doesn't apply to all cases. Or, at least, even when excess fat is present, it's rarely the only defect occurring. That's why you can't generalize and blame only the belly fat. The story is more complex. So, what is the most common characteristic, almost universal, with very rare exceptions, in practically all type 2 diabetics, even more so than excess body fat? Anyone want to venture a guess? The answer, which might surprise you, is low muscle activity, a direct result of chronic sedentary behavior. More and more, science has been showing how incredibly important our muscles are for overall health, far beyond just aesthetics or brute force. Muscles participate in several crucial metabolic processes. Think about it. You know that story about our metabolism, the rate at which our body burns energy and functions, that everyone says slows down with age? Lie. Or, rather, a half-truth. Did you know that this metabolic decline with age isn't inevitable? It happens, yes, but mainly in those who don't engage in regular physical activity. Metabolism slows down with age in the same proportion that a person, due to accumulated sedentary years, loses muscle mass and function. In other words, the decline has much more to do with the number of sedentary years than with chronological age itself. Why is this distinction so important? Think about two people aged 70. One has been sedentary for 30, 40 years. The other has always stayed active. Walks, goes to the gym, dances, works in the garden, it doesn't matter. Go check the metabolism of that super active 70-year-old. It's likely very similar to what it has always been. They feel physically capable, usually maintain a healthier weight, and don't show those signs of a slow metabolism. Was this luck? A divine lottery? Of course not. This person invested in their muscular health for years and is reaping the benefits now. And the good news is, it's never too late to start. Our body is kind of magical in this sense. It can compensate for some lost time in an incredible way when you decide to get moving. Don't give up thinking you're too old. Medical science now knows that people with low muscle activity over time, i.e., sedentary individuals, have a much higher chance of developing the infamous visceral obesity, that dangerous fat inside the belly, around the organs. They have a higher chance of having high blood pressure and abnormal cholesterol and triglyceride levels. And, of course, they have a much higher chance of developing prediabetes and type 2 diabetes. This only reinforces the point. Muscle tissue is central to this whole story. We talk a lot about fat, we talk a lot about the pancreas, which produces insulin, but they alone don't explain the whole picture of type 2 diabetes. Muscle is a main actor. Think about it. You surely know or have heard of healthy overweight people, right? People who visibly have excess body fat but get checkups and everything is perfect, no metabolic alterations. If the problem were only fat, how would you explain this? A 300-pound person with normal labs? And likewise, how would you explain the opposite, the thin diabetic, with no apparent excess weight? The missing link in this complicated story, helping connect these dots, can be largely explained by the health and activity of your muscles. Actually, I need to correct something I misspoke and emphasize this well. You don't need to have huge muscle mass. You don't need to imagine yourself looking enormous like a competitive bodybuilder. What you need is muscle activity. Your muscles, every single muscle cell in your body, need to be metabolically more active. They need to listen better to insulin, take up glucose from the blood more effectively, have their metabolism revved up by the demand of exercise. But you don't need to be buff or ripped to achieve this, okay? This is very important to avoid frustration. Some people start training, don't see their muscles bulging in the mirror, and think it's not working. Forget the mirror for a while. What you need to see is your plan performance in the workout improving. Is the weight you lift increasing? Are you able to do more repetitions? Do you feel stronger in your daily life? If the answer is yes, rest assured you're on the right track to improving your muscular and metabolic health. Understand the difference? Now, there's an important factor. The longer a person is sedentary, the bigger the problem tends to be in this muscular territory. The muscles become lazy, less sensitive to insulin. This decreases their ability to take up glucose, sugar, from the food you eat. It also reduces their ability to burn this fuel efficiently, and consequently, the overall pace of your metabolism slows down. All this accumulates like a snowball effect to cause problems like insulin resistance. The pancreas has to shout louder and louder with insulin for the muscle to hear, and eventually, type 2 diabetes. You've surely heard 1,000 times about the importance of physical activity in diabetes treatment. But have you seen it happen in practice? Have you felt it in your own body? It's truly impressive. If you haven't experienced it yet, you should give it a try. The ability of physical exercise to fix metabolic problems, lower glucose, improve insulin sensitivity is an incredible thing, very powerful, and very cool to witness. But then comes the million-dollar question. What type of exercise should you do? And this answer isn't so simple and direct because, first and foremost, I need you to do something that you can both keep doing for more than just 3 days. It can't be a flash in the pan, that burst of enthusiasm that lasts a week and then dies out. So, if I tell you to do an exercise you absolutely hate, that you can't see yourself doing long term, maybe it's not even worth starting with that. The best exercise is the one you shall actually do regularly. That being said, what I can tell you is this: any muscle contraction counts towards your health. But to optimize results, especially thinking about diabetes, I want you to look at the issue through the lens of intensity. There are physical activities that are high intensity, require a lot of effort in a short period, and activities that are low intensity, allow you to do them for a long time without getting too tired. Do both work for health? Yes. But are they equal in the results they deliver? Obviously not. Let's take the most classic example: walking and running. Many people start there. It's super popular, always recommended, and even more trendy today. Some people just walk, others prefer to run or alternate. It depends on fitness level, knees, a lot of factors, but the intensity reasoning is similar. What's the main characteristic, and perhaps the drawback, of light, steady walking? Everyone argues that it's very easy to do. Anyone can open their front door and start walking around the neighborhood. But will walking slowly to the corner and back help you much metabolically? Probably not a great deal. Why? Because it's a low-intensity activity. If you needed to, you could probably walk at that pace for an entire hour, maybe even longer, precisely because it's light. But here's the flip side. Because it's low intensity, very easy to do, the reward you collect for each minute of effort is also small. Think of it this way. The benefit per minute, calorie burn, muscle stimulus, insulin sensitivity improvement is low. So, for this small reward, accumulated over time, to generate a reasonable improvement in your glucose, for example, you need to accumulate many minutes of this activity. See the logic? Low intensity equals low energy expenditure per minute equals little emptying of the glucose bathtub equals needs many minutes to be worthwhile. And that's the challenge. If you have plenty of time to walk for 1.5 or 2 hours a day, great. If you love doing it, if it's your relaxation time, perfect. If your knees, hips, and spine can handle pounding the pavement for hours and hours every single day without complaining, excellent. Do it. The problem is, most people I know don't have tons of extra time, nor that much desire to spend hours walking, and often already have some knee or back pain that limits this prolonged activity. These people need to find another, more efficient alternative. Generally, what I suggest is that you consider doing something involving more intensity. For example, workouts generally known as strength training. This includes weightlifting, CrossFit, functional training, well-executed Pilates, anything that challenges your muscles to exert force against resistance. Real strength workouts are so intense for the muscles involved that they simply cannot last for an hour non-stop because you can't handle it. The muscle fatigues much sooner. Let's use an example similar to walking. Imagine you're going to walk, but now you put on a heavy backpack with maybe 3 2-liter water bottles inside. And instead of walking on flat ground, you're going to climb a long flight of stairs or a very steep hill. Notice you're still technically walking, but the intensity is now brutally higher. Are you going to be able to do that for an hour without stopping? Climb a hill with weight on your back continuously? Of course not. Your tongue will be hanging out long before that. That's exactly what I'm talking about. The more intensity you put into the exercise, the shorter the total duration you can sustain. Of course, there's an ideal point somewhere in the middle. It's also no use if it's so intense that your workout lasts only 10 seconds. That's why strength or high-intensity workouts are usually done in intervals or sets. where you repeat the effort multiple times with rest in between. For example, you climb the stairs with weight for 30 seconds, your heart pounds, your legs burn, you're gasping for air. Then you stop, rest for 1, 2, or 3 minutes, catch your breath, and go again for another set. It's just like a weightlifting workout in the gym. You do a set of an exercise, like lifting a weight, until the muscle burns and fails, unable to complete another rep. Then you rest a bit and repeat the set. Understand the dynamic? Intense, short effort, followed by rest, repeated multiple times. Now think with me. When you only do light walking training for a long time, you shape your body to become good at walking lightly for a long time. Your body adapts to that specific stimulus. When you do talk, strength and activity regularly, you shape your body in a different way. Stronger, with more metabolically active muscles, better able to handle intense efforts and manage glucose. Thinking about what you need for your overall health, especially in older age, which comes for everyone. What type of exercise will deliver more functional benefits, more quality of life, more independence? Do you prefer to be a great walker, able to walk on flat ground to the next town, but maybe struggle to get up from the sofa or carry groceries? Or would you prefer to have more strength, which you can use in any daily activity? Think about it. A stronger person carries groceries from the market with more ease and safety. A stronger person climbs stairs more easily if the elevator breaks or the power goes out. A stronger person can get up from the floor alone after a fall. A stronger person can run away from a stray dog, or any danger, with much more agility and power than the long-distance walker, who is good at endurance but not power. Strength transfers its abilities to daily life in a much more useful and protective way than just walking endurance does. So the question isn't just which exercise is best for lowering diabetes glucose. That question is important, yes, but maybe not the most important one long term. I'd like you to ask, which physical activity is best for the patient overall? Which one will make you better off 10, 20, 30 years from now? More capable, more independent, with the lowest possible chance of depending on your children, needing a caregiver, needing help to cross the street or get off the toilet? My friend? Because I know that independence interests you a lot. Light walking by itself won't deliver that. Believe me. Or at least, it certainly won't do it as well as other more intense activities that work your muscle strength. Did I manage to make a good case? Did I convince you now that even if you don't love the idea of strength training, your body likes and needs it and will thank you immensely down the road? And there's also the safety aspect, which many people get wrong. I'm convinced, based on my practice and studies, that it's much safer for most people, especially older adults or those with limitations, to go to a well-supervised gym for strength training, working one muscle group at a time in a controlled manner, than to simply go walking outside on the street. Especially if you're already a bit frail, if your street has potholes or is uneven, if you don't see very well at night, if your balance isn't what it used to be. You try walking around the neighborhood and the risk of tripping and falling flat on your face is real, and the consequences can be severe. In the gym, however, with a trainer nearby, at least initially, with machines that guide the movement, with exercises done in a controlled way, sitting or lying down, with no chance of falling off a chair or tripping, it's much safer, believe it or not. It seems like a paradox, I know, but maybe you were taught wrong about this. The people who usually get seriously injured in weightlifting are the young guys full of ego trying to lift more than they can handle or using bad form to impress. But we don't need to do crazy stuff. A well-executed strength training program, focused on technique and gradual progression, is extremely safe and beneficial. Are we agreed? How about giving it a try? These concepts about the importance of muscle and the right type of exercise are super important, and I really believe everyone should know a bit more about them to take better care of their own health. I hope you enjoyed this information. Remember that here on the channel, we have a lot more content about diabetes, metabolic health, and lifestyle. It's worth exploring the past videos and staying tuned for new ones that come out regularly. So, if you haven't already, subscribe. And turn on notifications so you don't miss anything. And if you want to further support our work of bringing quality information to more people, you can become a Patreon member of our channel. There's more content coming for you soon. A big hug.